Segue.
Hello, everyone. I have to stop laughing now. I'm Dave Dresner. I am the director at the Freedom Center, the Center for Independent Living that serves Frederick and Carroll counties. I want to welcome you all today. We have a very special show. We have a lot of information. We're going to be talking about the legislative session, grassroots advocacy, how to be involved, things that are coming up. We have special guests with us. Delegate Bel Castro is with us. And so I don't want to take a lot of time, but I do need to do a couple of the sort of important announcements that you need to know. These shows are recorded. And in fact, I believe we're already being recorded. Once we officially go, and it looks like you've already done that, you'll be put on mute. If you have questions, when we have time for questions, we'll take people off mute. You'll be able to unmute yourself and ask questions, or you can always put questions into the chat. We will be monitoring the chat and make sure that we get everybody's questions answered. I think towards the end of the session, we're going to be opening it up for discussion if we have time anyway. So that should help that process. I do just want to say again, the Centers for Independent Living collaborate together to bring you this program. Special thanks to the Image Center who does all the technical background stuff, and Heather specifically back there who monitors those things. If when you register for each show, you'll notice there's a place where you could make a generous donation. Those donations go directly to helping us keep this opportunity going and this forum going. It does take time and effort and money to do that. So if you are so inclined and are able to contribute, we greatly appreciate that. If you have questions that don't get answered, if you need services, if you're not sure what a Center for Independent Living does, I'll just be really brief about that. Centers for Independent Living serve persons with disabilities across all disability groups, across all ages, and we cover the entire state of Maryland between the 7 centers for independent living that are here. Information and referral, advocacy are some of the core services that we do, and so you are always welcome to call or reach out to any of your Centers for Independent Living. If we are not the right one, we will connect you with the one that was. That just actually happened earlier today. I got an email from Heather from somebody who asked a question that concerns Frederick County, and I'll be getting back to them once this show is over. So it really is a good process. We always welcome your input and your calls. There's also a place to give input on upcoming shows and events for IAM itself, and we really do appreciate that. This is your show for our community. It's our show for our community. I'll say it that way. And I know because so many of you come week to week that it really is something of value. So I think I hit all the things that I need to hit. If I didn't, Heather or Mike will jump in and tell me. I want to introduce and turn it over today to Rose Carey. She is the chairperson of the Maryland Statewide Independent Living Council. That is the council that's appointed by the governor that helps to coordinate independent living services and the independent living network across Maryland. They are integral in developing the state plan on independent living in conjunction with the Centers for Independent Living. Rose has been with us a long time in the independent living movement, and on a personal note, she was one of the first people who reached out to me when I was hired here at the Freedom Center to extend a welcome and an offer of anything I needed help with. She's that kind of person. So she's currently serving as the chair of the Council on Independent Living, and she is going to start us off. So I'm going to turn it over to Rose.
Thanks, Dave. As Dave said, I'm the newly elected chair of the State Independent Living Council, and I'm looking forward to the next couple of years trying to get this organization move forward, because it's really difficult during this pandemic. But we've got a lot of good people on. It's nice to see some familiar faces and also some that I don't know. So I'm looking forward to meeting all of you. Excuse me. I want to thank the legislative committee for all their hard work. They've gone to a lot of trouble to identify the bills and to make this platform presentable for the people with disabilities. And it was done with the help of the SILC members, the SIL directors, and volunteers. So I especially want to thank all of them for their hard work. And at this time, I'm going to turn it over to Katie and Lori as co-chairs. Thank you.
Thanks, Rose. So yeah, we have been hard at work trying to build our first ever public policy platform. This was a big undertaking for us. So we're really excited to share it with you. I want to just give a shout out to all of the members of the committee. So Rose Carey, Lori Alanoff, Cheryl Grossman, and then my fellow SIL comrades, Sarah Basehart, Mike Bullis, and Dave Dresner. So all of you, oh, and Serena. Did I mention Serena? Serena, staff at Independence Now, sorry. There you are, Serena. You guys have all been really great to work with. And I think Lori, I can speak on our behalf that as co-chairs of the MSILC Legislative Subcommittee, that we are very proud to present this to you. So I am going to share my screen and share with you our public policy platform. So all in all, this is a public policy platform, and it just identifies what we believe is the appropriate policy for the public. This guides the SILs in their advocacy efforts. Sometimes it's lobbying, sometimes it's educating, but it kind of outlines what we see as being the priorities. Now, this is the Maryland Independent Living Network Public Policy Platform. So it is the Centers for Independent Living in conjunction with the Maryland Statewide Independent Living Council. Dave earlier provided you a little synopsis of what people at Centers for Independent Living can do for other people with disabilities. And this document also kind of surmises that. So people will be able to share this with their legislators if they would like and know what it is that we do. So we've identified several areas. Now, please keep in mind that we tried to keep this a one-pager front and back because we know that our legislators do not have time to be looking through pages and pages of documents. They're very busy. So we tried to keep it as kind of short and to the point as possible. Not everything that we encounter during the legislative session fits in this, but this is kind of some guiding principles that we're using. Now, of course, we all know that housing is a huge issue, particularly for people with disabilities, particularly for people who are living on very limited incomes. So we want to increase the number of units available, increase vouchers for units, improve renters' rights and enforcement of fair housing, provide the Centers for Independent Living, who currently do housing case management services, with funding to do that service. We do it, and we do it because we are good people. But it has become increasingly difficult for us to continue to provide the high level of services that are needed to help people with disabilities in our communities who are not connected to a case management system. And then, of course, increasing funds for home and rental accessibility modifications. We know that being in your home and your community is the best place for people to be. If we're able to increase funding for that, we can keep people out of institutionalized settings. We also know that transportation is a huge issue. So, we want to increase the amount of accessibility at trains and bus stops. We want to address the issue of floating bus stops, which have been a hot button issue lately. We want to work to increase transit routes and times, particularly in rural areas. Increase the reliability of public transit, making sure people can get to where they need to be when they need to be there, and then are able to get back home in a timely manner. We want people to be able to travel from Baltimore City to Southern Maryland and make it easy and seamless. So we want to be able to increase the options available that cross jurisdictions. Also, we know that it's not just getting in a vehicle to get somewhere. Oftentimes our sidewalks and curb cuts and their maintenance need a lot of help. And if you can't get your wheelchair to the bus stop, what's the use of having a bus stop? So we want to increase the accessibility of the kind of the way to the bus stop. And then increasing the number of accessible taxi cabs per county to 10%. Healthcare and long-term services and supports. We really believe that medical institutions shouldn't be able to aggressively seek payment. So we want to work on limiting their ability to do so. We want, when people go to the doctor and get a medication prescribed to them, we want them to be able to get that medication if they need it and make that medication affordable. People who use private insurance, who don't use Medicaid or medical assistance, we want to be able to see those people get increased access to durable medical equipment. We want to require that private insurers match Medicaid home and community-based services options. Right now, as it exists, if you need someone to come into your home and assist you, oftentimes the private insurance companies do not cover that. You need medical assistance to be able to get that kind of service. So we don't think that's right. You shouldn't have to choose options like going into a nursing facility just to get what you need. We are opposed to the use of physician-assisted suicide or so-called death with dignity measures. We would like to require interagency cooperation to enforce most integrated settings, so we can ensure that people, when they are in the community, have access to housing, transit, healthcare, personal assistance services, all of that, to ensure that they will be successful in those settings. We have a whole section on ending the institutional bias. So what we know is that people with disabilities, oftentimes to get the assistance they need, have to get it in an institutionalized setting. So we want to increase home and community-based services regardless of who is paying for them. We want to designate a facility residents as homeless, allowing for emergency shelter placement, which will help for housing. Olmsted said that people needed to get support in the most integrated settings, least restrictive environments, and allow for 24/7 support in the home. Or we need to allow for 24/7 support in the home. And we oppose any development or continuation of congregate or segregated settings. In employment, we would like to see more flexibility within the Employed Individuals with Disabilities Medicaid buy-in program. There's provisions in that program where you can't get REM, rare and expensive case management. You also, if you get married and your spouse makes over a certain amount, you're kicked out of eligibility for that. So we'd like to see more eligibility or more flexibility within EID. We would love to see the pay increase for direct care professionals, particularly in the community options waiver, community first choice, and community personal assistance services. These, the people who provide services in these three funding streams are being left behind, even those who provide services for other waivers. So we would like to see an increase in pay. And we'd love to see the state employment of people with disabilities to 20% across all levels of government. Education, we want people who, we want the Individual with Disabilities Education Act funding and compliance from IDEA and plans of the Section 504 of the Rehabilitation Act. So we want to see people getting the services they need in school. And we want to mandate intended resource sharing between public and private schools regarding individualized education plans. Right now, private schools do not have to comply. We do have a section on emergency preparedness, disaster response, and COVID-19 response. And while this is a small section, it's been a bulk of the work that the Centers for Independent Living have been doing over the past year. We want to ensure that any Medicaid waiver is compliant with disability civil rights laws, including the Americans with Disabilities Act and Section 504 of the Rehab Act. And one thing that has become increasingly alarming is that we have people in nursing facilities who would like to get out, and we don't have a fast track system to have them seamlessly transition out of the facility and into the community. And they are in crisis. So we would really like to see for future disasters that is changed. Voting. We would like to reinstate automatic absentee ballot lists without having to re-register each time. So if you have registered, at any point for an absentee ballot, you can get it again and again and again without having to re-register. And we want to commit to ensuring voting is accessible to all people with disabilities. This is a big catch-all category, but we've learned a lot, particularly during the pandemic in terms of voting, people not being able to get their ballots in the ballot drop box because the slot was too high, or, people not having the tools that they need to vote absentee. We want to ensure that any legislation that comes out of this session is making sure that voting is more accessible. And then, of course, digital equity, which I'm not sure would have made it on this list were it not for COVID-19. We would like to increase funding for technology for students to participate in virtual learning, fund training in the use of online devices and programs, particularly in terms of digital literacy. How do you get on Zoom? How do you create a Facebook account so you can stay connected with friends and family? How do you buy groceries online? These are all things that would be really important for someone to know who might not have ever been on a computer before, as well as safety. How do you keep your information safe? There's obviously a lot of people looking to prey upon internet users. So how do we teach people to protect themselves? Of course, high speed, low cost internet. We want to support people who are low income in obtaining that. And increasing high-speed internet statewide. We still have a lot of rural areas that are lagging behind in that, so we want to see that changed. And then something that has become very clear to the centers as we continue to work within nursing facilities is that we would like to see an increase in access to private independent communications in nursing facilities, both through the use of telephone, but also internet. Not everyone has access to that. So I felt like I just did a whole lot of talking in a very short amount of time. I am going to, I can put this document in the chat in case you would like to see it. It also has Lori Elenoff and my email address. If you have any questions, feel free to share this as talking points when you go to talk to your legislators this session. And if you have any questions, we will take those at the end. So now I would like to turn it over to Delegate Belcastro, and she's going to talk to us about engaging in this legislative session.
Thank you so much. And thank you, Katie, for inviting me. And thank you to all of you for the opportunity to talk with you today. I used to be on these calls in the summer. I was joining you guys weekly. And then you might not know this about me, but I'm a full-time special education teacher when I'm not serving in the legislature. So 2 o'clock on a Monday afternoon happens to be right in the middle of Miss Perez's 5th period class. So I haven't been able to attend since school started. So it's good to be back, and I look forward to joining you guys more frequently once the summers pick up again. So this session obviously is fully virtual, very different. This is my first year in the legislature, so this is my normal. This is what I understand. I haven't been in the legislature under normal circumstances coming in during a pandemic and COVID, but I wanted to talk to you guys about how things have been working this session and the best ways that you can engage. Katie, thank you for sharing all of those policy recommendations that you and the committee have worked so hard on. And hopefully what I talk about today will help you advocate for the initiatives that you have identified are important for you this legislative session. So the biggest thing that I want to mention, and this is a big deal and something that we need to advocate for that sticks even outside of the pandemic, is how everything is live streamed. You can watch everything from home. Every voting session, every subcommittee meeting is live streamed, and that wasn't true in the past. So you can watch that bill from when it's introduced or when it has its hearing, and you can really watch it go through that entire process. the way that you can easily this is the easiest way to access it, because I will say one thing we need to be better at is on YouTube, how we organize the streams. It can be a little difficult to find them. So here's a tip for you, and it's the easiest way to find them. If you go to the Maryland General Assembly website, in the top right-hand corner, and this took me a while to figure out, even for myself when I wanted to live stream things, there's a little icon that says YouTube. If you just click on that, it'll come up all the different, it'll have the House and the Senate. You can just click on whichever chamber the bill is in that you want to see. Or the hearing the committee that you want to hear. And then you'll click on the House or the Senate, and it will list all the different committees, and it'll take you right to the YouTube page. I was for the longest time trying to type it in the search bar in YouTube, and I just never ended up where I wanted to end up. So that's the easiest way, and that took me a couple weeks to figure out. Next is the MyMGA website. So there's some love-hate with that MyMGA website right now. This is how we're submitting testimony this year. This is how you are signing up to be a witness on any of the bills that you want to testify on. And I say love-hate because some of those in the aging community, some of those in the disability community have had difficulties navigating the MyMGA website. There have been some fixes since the beginning. I understand that screen readers are working better on the website now. But to access MyMGA, again, you'll go to the General Assembly website. In the top right-hand corner, it's going to have a couple different icons, some social media, the YouTube, and then you'll see a little icon that says MyMGA. You'll click on that, and it's pretty simple to sign up. You'll just type in your email, your name, and then you'll have an account pretty quickly. And what's really cool about MyMGA is I even use it. This is how I track my bills. You can select the bills that you want to track, and every night you get an email about how your bill is doing and how it's progressing through the legislature. So you're getting that reminder, that email each day about the bills that you're interested in and how they're moving. And I've found it quite useful myself. Let's see, what else did I want to mention about MyMGA? For the people that we've in our office, we've had more than a handful of people that have had issues with MyMGA, just in terms of being able to find it, navigate it. So my suggestion to you, and what we've done in our office, is that we've individually helped people sign up for MyMGA. We've helped upload testimony. We want to make sure, while I do believe the legislature has acted in good faith, and they've worked as hard as they could to make this virtual session as accessible as possible. Obviously, there's always room for improvement, but what we've decided in our office is that, look, we're here, this has happened. We need to just help people move forward to get their testimony in. So what we're doing in our office is like I said, uploading testimony for people if they need it, signing people up for accounts if they need it. And I don't see why any other legislator would have a problem with that. So if you are struggling to navigate it, I would just reach out to your legislator. And if they're not responding, you can reach out to us and we'll help take care of you. Another thing, this is kind of a kept secret that I'm learning a lot of people don't know about. And I wish more of my constituents were taking me up on this offer. It's virtual constituent office hours. So a lot of legislators are doing virtual constituent office hours. I'm doing my best to pump out on social media that we're doing this, put it in my newsletters. But you're not able to come to Annapolis this year. We don't have the typical office hours where you knock on our door, you come in, you meet with us and talk to us about your bills. Well, it's still important to have that FaceTime. It's still important to engage with your constituents. So every Monday morning, we host virtual constituent office hours, and that's an opportunity. I just pop the Zoom open. And it's an opportunity, for that hour, I'm just sitting there. Anyone can come in and talk to me just as if I was sitting in my office chair, and you would knock on the door and want to come talk to me about your bills. So, reach out to, if you're not finding it on social media or seeing when the virtual constituent office hours are for your legislator, just send them an email. I'm always happy to welcome anyone, even if you're outside the district, welcome you to my virtual constituent office hours at 8 a.m. every single Monday.
Lisa?
Yeah.
Hi, my name is Tioke Hassan. I'm new to I've been on here before. Are you familiar with Alliance Incorporated?
Not familiar.
Well, are you ever been out White Marsh?
White Marsh?
You ever heard of Mosaic?
I don't believe so.
Well, I'm with them. They're out. They help with getting people with disabilities jobs.
Awesome.
Yes, they used to be in Dundalk, but now they're out in they're owned by Shepherd Pratt now.
Okay. Hey, I would love to talk to you more about that. And if you would like, you can join me at 8 a.m. any Monday throughout session for my virtual constituent office hours. I'd love to see
So
you.
you work with the legislative branch? What program are you with?
So I have the distinct honor of representing District 11 in the House of Delegates. So that's my involvement with the legislature.
Oh, really? Remind me of a woman I used to work with at Alliance named Sam Allick, if you look her up on Facebook.
Okay.
But
Well,
yeah,
Chioke, we have a really packed agenda, and I would really encourage you to reach out to Delegate Belcastro during our office hours, and maybe you guys could catch up that way. I just want to make sure we get through all this material that we have.
Because I take MTA.
Okay, great.
Because you know that they're
Wonderful.
downsizing due to this pandemic.
So honestly join me for virtual constituent office hours, and we'll talk more. But I'm going to finish up now. I'm almost.
Can you send me your info, please,
yes,
Lisa?
I'll put it in the chat as soon as I'm done talking. Okay, I promise. So what I want to leave you with is overall, this is the most accessible session ever, and I think it's important. While it's never perfect, right? There's always going to be things that we can do to make it better. We should continue to work and push the legislature to make it better. I know myself and my colleagues have been pushing on a number of things. We were really happy that they took us up on the screen reader part about the website. There's still more we can be doing. As we start to hopefully move back into whatever normal will be after this pandemic, I think it's important that we continue to advocate to make sure some of these things that we've brought in this digital setting, this digital world, stick. It's a good thing that you can watch from home all the different bill hearings and watch it travel from the hearing to subcommittee to the voting session. You can watch even down to delegation meetings are live streamed now. If something's being voted on or something's being heard, it's live streamed. And so it's important that sticks. And I think that that's important for the disability community as well. So I will wrap up there. And if there are any questions, I would be more than happy to take them. Again, thank you for allowing me to speak today. It's good to be here.
Thank you, Delegate Belcastro. We are one of your biggest fans, and we always appreciate your support and your willingness to engage with us. It's always refreshing, so I really appreciate it. I'm going to quickly go over some of the things that we've been working on. Now, please keep in mind, we are a small but mighty team, and we have not been able to focus on nearly half of everything related to disability in this session. We've focused on a few things that we have found particularly important. So I'm going to share with you what that is, and then I will share with you a link in case you would like to follow up on it. And again, this is a work in progress, major work in progress. So we've been working, and for those of you who can see my screen, we have a key here. It's color coded, and we've had big controversies over it, but it helps keep me organized. So anything in green, we've submitted testimony on. And when I say we, it's typically some of the Centers for Independent Living, not the Statewide Independent Living Council, because that would be considered lobbying. So if it's green, we have submitted testimony. If it's blue, we've signed on to existing testimony. And if it's red, there was no action taken. And it could be because we got off to a late start. So the first bill would be Senate Bill 348, House Bill 652. And this requires that there be some additional reporting done by residential service agencies to ensure that people who are working as personal care attendants are appropriate classified as not a contractor. Sometimes agencies will classify what should be employees as contractors, so they don't have to pay things like benefits or taxes. And that makes it so the workforce has reduced quantity and quality of people. So we wrote in support of this bill. There's a huge housing justice package, which we signed on with committee. I'm not going to go through all of these in detail, but it does lots of great things. It establishes an eviction diversion program. It provides right to counsel. There's limits on filing surcharge and prohibited lease provisions. All of that we have signed on to. And I think there might even be a few more bills that have come through that I probably need to update this list with, because it's several different, it's huge. It's a big package of a bunch of different bills. Delegate Belcastro, yours made our list, but we were just too late to respond. So that was really early in session. The Maryland Suicide Fatality Review Committee, which we thought was a really cool idea. Delegate Belcastro had posted on her Facebook that they found that things like people at shelters, before people would decide to attempt suicide, they would drop their animals off at shelters. And so wouldn't that be another place that you'd want to provide some extra attention to if you were in the business of preventing suicide? You'd want to, make sure that people could identify signs and have available things for like, hey, are you feeling depressed? Come call this number. So I thought that was a great idea. And that has already been heard in House and Senate. So, and I think we're just waiting at this point.
So it's starting to get some movement. So I thought it might be dead, but it's starting to get some movement. So I actually feel somewhat hopeful as of this week. So we'll see how things progress. But thank you.
Well, we'll keep our fingers crossed. A big bill that we've spent some time on is the medical debt protection. It does a lot of different things, but bottom line is it really protects people if they've gone into the hospital and they have huge hospital bills from having their home, place a lien on their home or their car, bank garnishment of wages, and filing lawsuits. So it really protects people. And a lot of people with disabilities also have, different kinds of health needs that require sometimes hospitalization and can get very expensive very quickly. So we have provided written testimony in the House, and we will be providing written, and maybe if Mike gets chosen, spoken testimony in Finance in the Senate. Of course, voting was one of the big hot button issues. So we were too late for both of these elections by mail, as well as accommodation for voters in need of assistance. But we would be probably supportive of both of those. Put in testimony for both the bill in the House and the bill in the Senate, and it makes sure that that right now, when you use an accessible ballot marking machine, the ballot that comes out of that is different than the machine that other people use, and so this would require that the ballots look the same, because otherwise you could potentially identify whose vote was for what. If only 2 people in the entire precinct use the accessible ballot marking machine, then you would know that how those 2 people voted, because their ballots would look different. HB 155, SB 98, it prevents discrimination in private schools, public schools. We were too late on that one. I didn't spend a whole lot of time with it. Affirmatively furthering fair housing. This is something that in the Obama administration was put into play, and it was dialed back during the Trump administration. So this is the state saying we want to affirmatively further fair housing. So they're trying to get that back on the books. There was a digital equity bill ensuring that people with disabilities get access to high-speed internet. We were too late for that. Next year will be better because we'll have our public policy platform all done. Then there was the funding of the Transit Safety and Investment Act. Obviously, transit is, a funding priority for the disability community, and it's been difficult to ensure that funding is there and meets the needs of the people people needing the service. More election. So another one with allowing individuals who need extra assistance to be giving priority when they get to the polling place. Development of the direct care workforce innovation program. Again, personal care attendants, the direct support workforce, are the backbone of many people's independence. Their ability to get up and get moving out of bed, get into the community, sometimes requires personal care attendants. And so we want to make sure that personal care attendants are high quality, well-paid, well-trained staff who can meet the needs of people with disabilities. And then the rest, okay. So then we also have the accessible rooms for individuals with disabilities. This, so there was a bill that was put into place that said that hotels would have to have a certain number of rooms whose beds met this certain accessibility requirement. So people with wheelchairs or people who use Hoyer lifts could use the hotel beds. And this bill is asking for an extension of that deadline. We will be writing in opposition to this. Obviously, the ADA is 30 years old, and we just need to get it together, United States of America, including lodging establishments. There's a bill out for curbside voting, which I thought was really cool. Don't have to leave my car. You come out to me, bring. Again, this could increase accessibility, particularly people with disabilities who might have a hard time leaving their car, but still want to cast their vote at the polling place. This next one, the hearing's canceled.
Ash Wednesday. I saw that the other day. So if you can get your ashes on the curbside, why not vote curbside, right?
Right. I'm liking it.
You can do what vaccination stuff do you have on here?
So we don't have, we don't have any vaccination specific bills at this time.
Yeah.
It depends what comes out of session.
Oh, really?
So, yeah. So we have, one of the things that I thought was astonishing is that there are actually polling places that are not accessible by public transportation. And I was just really surprised by this. I would think that that would be a basic thing. So this ensures that early voting centers must not be more than 500 feet from public transportation station or stop. There was a hearing on House Bill 69 about single-use plastics. For people in the disability community, often many of us rely on single-use plastics when we go out to eat. Straws are one of the greatest accessibility tools of all times. And sometimes not everyone can use, an alternate plastics or alternative of plastic straw. And so this pertains to food, single-use beverage, as well as, which I'll be kind of sad about, because I used to, when I go to hotels, I'd collect the little samples and make like little packages to give out to people, but they would be prohibiting those little packages, like the little cute shampoos and soaps to reduce plastics. And lastly was the student education grant program to establish it. This would provide grants to eligible students to attend non-public schools. And had we been on top of this, we probably wouldn't have been very supportive, because private schools don't have to honor the rights of students with disabilities in terms of IDEA. So we didn't feel that we should be giving, the state should be giving money to them if they're not having to comply with IDEA. So that is all we have for now. If anyone has a bill that comes across their desk that they think should be included, please let us know. As I said, we are definitely small, but mighty, and we're trying to do this once a week. We meet for 1 hour and try to cobble together everything that's going on. We don't have a dedicated lobbyist. We don't have, an organization that does this for us. So I will put the link here.
Hey, Katie, Cheryl has a question there in the chat about House Bill 493, a voting rights bill.
Oh, and then she said, never mind, you got it.
Oh, sorry.
Okay.
Heather,
so we're good.
Heather, this is
Hi,
Beth.
Beth.
Hi. You say you don't have a lobbyist. I have found, my opinion, this is my opinion, and I'm not a professional, is that when you have people testifying, submitting testimony, I think it's more effective for this kind of work than a lobbyist. So I wouldn't be concerned that you don't have a lobbyist. I think, as you say, your group of people are far more effective than a professional lobbyist getting up there and talking, who doesn't really know what the people are feeling and thinking.
So I want to just echo what Beth said. Beth, thank you for saying that. I think as we, I don't want to say younger people. I think there's a large block of people in the legislature that absolutely appreciate the testimony of everyday people in Maryland over that of a lobbyist. Because when a paid lobbyist, at least me, I know when a paid lobbyist comes up to submit testimony, they were paid to be there, right? Like they're paid to represent a specific interest. And I would much rather have the opinion of those who are boots on the ground, which is every one of you, who we know are lobbying on behalf of people because they just care, right? So yeah, it matters to me when you guys show up and testify on behalf of a bill. And I'd say that that's true for a lot of people. So don't underestimate the work that you're doing. It is really important. And I've seen Mike a couple of times in my committee now, and I always get a good smile when I see him there.
If you ever look at the legislators as you're testifying, you'll see that they drop everything. They drop their pen, and they look right at the people, and they're really interested, and they ask questions of the people. They're really interested in the people's stories.
Yes, thank you. Thank you for that. Someday we hope to have someone who can organize all of these great people to get them there. And I guess that's also what I mean. Like, we don't even have that. We don't even have someone to organize people. It's just us. But yes, thank you. Thank you. So I was going to turn it over, and we're running low on time, but Sarah, did you want to briefly talk about how a bill becomes a law?
I think you should make me absolutely last. I thought there was something Mike.
Okay.
Was there something Mike had to share?
Okay. Yep. So Mike, you were going to talk about the website, and I have a video I can share too that's short.
Oh, well, okay. But Delegate Belcastro did such a good job. I thought I got off the hook. But yeah, show that little video that shows you this MGA website can be a little intimidating. I didn't have any trouble with it until I got to the place where I wanted to upload some testimony, and it wouldn't tell me whether in fact I had been successful at that. I understand that they're working on that little glitch, but otherwise it's a columnar thing. For those of you who might be blind and use screen readers, it means you have to hold down the Control and the Alt key with your left and right arrow and your up and down arrows as you move through the table so that you can get to the bill you're looking for. But sure, let's run this little video, and then we'll come back and see if anybody has any questions. You'll probably have to turn on your audio. We always get into trouble with this because it'll start showing the video, but it won't automatically give you audio.
Someone who wants to actively participate in the Maryland legislative process, MyMGA is for you. When you have a MyMGA account, you can track.
What is a MyMGA?
Through our automated system. Also with an account, you can sign up to be a witness at a bill hearing and provide testimony. But before you can do anything, you have to create an account. It won't take more than a minute.
I guess I'm really testing the bandwidth.
Click the MyMGA icon at the top right of the MGA website. Click Create a MyMGA tracking account or click Register. Enter the requested information in the fields. Click the Register button. Go to your email program and open the confirmation email. Follow the directions to complete the registration. Your browser will open and you will see the Account Registration Complete window. Follow the directions to sign in. Enter your email and password and click Sign In. Your account is all set. Each time you log into your MyMGA account, the landing page is the Bill Tracking Lists page. This is where you'll set up lists of bills to track. We'll show you how to do that in another video. For now, we want to show you a couple of other things about your account. Should you need to change your password, select Change Password from the menu. Select Edit Account to change your account information. If you ever want to cancel or unsubscribe your account, select Cancel Account from the menu. This will immediately delete your account and a new one will need to be created if you wish to track bills in the future. Refer to the FAQ document as another source of help with MyMGA. Use the Sign Out button to log out of your account. We hope that you have learned how to create your MyMGA account. If you have any questions or comments, go to the footer at the bottom of the page and select Contact Us. Click Send Feedback to send an email to webmaster@mgadls.state.md.us. Thank you for visiting the Maryland General Assembly website.
Yeah, the only thing I would say is if you think you want to submit testimony, or if you think you wanted to submit, if you think you want to testify, you should go to each committee has its own website, and you should go there and look and see what their rules are, because they are somewhat opaque to me. Some committees have you sign in on the Thursday before a Tuesday. Some of them won't let you sign in before 10 o'clock or 9 o'clock in the morning. Others, I've been in a couple of lotteries now where basically they say, hey, thanks for asking if you can testify. We're gonna put your name in a hat and we'll let you know if your name gets drawn. I don't know how that happens, but just be aware that each committee is going to have a different process. So you want to go look at that committee website and see what the rules are around when and how you can submit testimony.
Great. So there's definitely, I posted the link for that in the chat. So if you need that, and if you need further information, feel free to reach out to any of us. We can help you with that. So next, I'm going to move on to Lori, my esteemed co-chair of the MSILC Legislative Subcommittee. You're on mute, Lori.
Hi, everyone. I just want to throw a shout out to Katie, because she has done a yeoman's job in all of this. Yes, she's had a lot of support, but she's done an incredible job. And thank you so much, Katie. And it's posted on the MSILC website and possibly other websites in this room. So feel free to look at that as well. And I'd like to know that if anyone has any other things with legislation that they want to bring up right now. Any other bills, anything that's on your mind with regard to the session? Make my job very easy.
We wanted to provide the opportunity for anyone here who might know of any legislation, or if legislators had chosen to join us that wanted to bring up anything pertaining to disability. So this was our opportunity for that.
Okay.
So this is Cheryl. I don't know the bill number, but it's one of Delegate Ruth's bills that would limit the amount of time that prisoners can be in solitary confinement, which the state uses a different term for that. I'm drawing a blank on it. I know that she was working pretty closely with DRM on that bill.
Thanks, I'll add it to my list.
Thank you. Thank you very much. Are there any other bills out there with disability issues? It's on your mind?
Hello?
Hi.
Yes, I'm Chioke Hassan. Yes. Just wondering, you guys help people with mobility also, with MTA mobility?
Chucky, what county are you in?
Baltimore.
You're in Baltimore. So the folks at the Image Center, if you're having trouble with mobility and need, to talk to someone about it, the folks at the Image Center can help you. How about or Heather, can you put your phone number in the chat?
I think Chioke knows Amanda Taylor. He's had contact
Yes, I
with
know
us.
Amanda.
Yeah, he knows, and Crystal.
Yeah, Crystal as well. So,
Crystal
he's
too.
all
Where's
connected.
Crystal?
I don't know if she's
not
here today.
She didn't ask for permission not to be here, so I don't know.
Okay.
Okay,
Yeah, 'cause
so
they have to cut down on this because of this
So, yeah, I had one sort of COVID related advocacy issue to bring up before we finish, but go on through your agenda if you want.
Okay, well, I was just going to quickly, Sarah was going to talk about how a bill becomes a law. So, Sarah.
Yep.
I'll deal quickly with my COVID advocacy issue. I'm very concerned that in the way we've rolled out COVID in the state of Maryland, we've left out significant groups of people with disabilities. And they're not anywhere on the list. I don't care if you go to 1A or 2 or B or phase 2 or phase 3, they're not there. And it's specifically, it is people who either need personal assistance services or people who have a nursing home level of care who live in the community. They don't live in congregate settings, and they don't live in, and they're not under Medicaid. They're not DD, so they're not getting specialized access necessarily to vaccines that way. We've got to find a way to get the state to understand that we understand that this is an oversight, but the oversight needs to be corrected. We've got to get access to vaccines for the thousands of people who are living in the community because they can't social distance. They need personal assistance services, but at this point, they're not prioritized except by age. So any thoughts you folks have on that, any advocacy, please feel free to reach out. Cheryl Grossman is working with the Image Center on some of the advocacy issues around this. So please feel free to reach out to her. That's sgrossman@imagemd.org. Somebody might want to throw that in the chat box. But I think it's a very critical area because right now is when you would think our people would be being prioritized, but they don't exist on the list.
This is Cheryl. Thank you, Mike. I just want to have my phone number out there also because it's much easier to reach me that way. If someone can put it in the chat, it's 314-863-3211. Thanks.
All right, thank you, Mike. Sarah, Bill, up the law.
Okay, so you wanted me to go ahead with this then. So I know how quickly this becomes boring and or overwhelming. So I will try to go quickly, but it's always nice to refresh yourself on how a bill becomes a law as we enter now I'm almost midway through, I suppose, of the legislative session. So I'm late teaching everybody this year, but so bills are introduced by senators or delegates, right, on either side of the legislature. And then they get introduced on the floor of that House. So on the House or the Senate side, every bill gets read before the entire group in their floor sessions, and then it gets assigned to the appropriate committee. So you hear people talk about all these committees, right? And if you haven't been involved in the legislature, that can be confusing. But there are 6 or 7 committees on the Senate side and 6 or 7 on the House side. Some sound similar, some sound completely different, but they get assigned to a corresponding committee for closer review, as well as that's where hearings take place and testimony takes place. So you have the bill introduced on the floor, gets assigned to a committee. They have the it gets read a second time. It's a little weird and kind of unnecessary to know, but then it gets read a second time and heard in the committee of the other house. So you sort of have to move through one side and then through the other side. So it goes to a committee, has a hearing. If it's passed, goes back to that floor for action. They either pass or don't pass the bill at that point, and then it crosses, they call it crossing the street. So then it goes to the other side and has the same thing take place again. So then it gets assigned, it gets read on their floor, gets assigned to a committee, has a hearing, and with testimony, that's where the public is involved, and then goes back to the full House or Senate for vote on the bill. And if it, any changes can happen at any time. So it can get very confusing and complicated because they can change things in committee. They can do amendments. They can do amendments on the floor of each of the full side of the House or the Senate and then send it on. Sometimes legislators get really smart and they introduce, they have like a colleague on the other side of the street that introduces the exact same bill. So you can have the exact same bill on the House side and the Senate side that start at the same time, which is really helpful at getting things through more quickly, as you can imagine, right? As long as they stay the same. Sometimes then amendments will be made on one side and not the other, and it gets sort of fuzzy again, and it has to cross over to the other side for hearings. So then once it, so if a bill has moved through the House side, through the committee, past the committee, gone to the full House, passed through the full House, goes over to the Senate, goes to a committee, passes that committee, passes through the full floor of the Senate, then it goes back to the House for like another review to make sure it's all good, and then it goes to the governor to be signed or vetoed, if that happens. So do any of you remember, so it can be quite a process, and it's why we have so many bills and then so few actual laws that get made each year, right? Because it takes so long for that process to happen. Do any of you remember the Saturday morning, I'm Just a Bill sitting on Capitol Hill, the little video that they used to play on the Saturday morning cartoons? Those of us who are in our 40s and 50s remember them very well.
Yes, indeed, my mom does. I'm just a bill sitting on Capitol Hill.
That's right. It had a very Southern accent. It was perfect. And it was a really good explanation. We still use that video at our youth leadership forum because I still think it's the best one to explain what happens. And if you're a visual person, it helps because it's walking through in a visual way, but it also has all those catchy tunes. So if you're an audio learner, it helps in that respect as well. But I'm happy to answer questions. I went to school for a long time for policy work and did an internship, but I still have to like remind myself of these processes each year and how things happen. So I'm happy to answer questions if you fell asleep, I'm sorry. And we'll be back next Monday with something more exciting than that.
I've got a question. If a bill is introduced and in other words, it's the same bill introduced in the House and in the Senate. Yep. So that they each gets assigned a committee in each.
Yes.
Okay,
right.
so we'll start out the same, but we'll get different.
It can happen that way. It depends. So, and that's, another thing is it always depends, right? So two colleagues might work together, one in the House side, one in the Senate side, write the exact same bill because they want to work on it together and they know that it goes faster if they do that. But if amendment happens on one side and doesn't happen on the other side, then the bill has to cross over and go through the same thing. If it moves through exactly the same way, or they get the same amendments, which they also will often try to work on, although it isn't always completely under their control, right? There's more than just a couple people at the legislature. And so if they get exactly the same, then it can move through and it doesn't have to cross over if they remain identical. And then it'll sometimes go to like a conference committee that reviews things at the very end and puts them on to the floor, so.
Okay, so if I, as a constituent, if I'm very concerned about a piece of legislation, is it important for me to, when that bill is in committee, is it important to me to contact committee members to let them know, how this bill will affect our people?
Yeah, you still want to, to you, it's still two bills, right? So it's still got to get through both sides, regardless of whether it was introduced identical or not. So absolutely, it's still important on both sides to make sure that you're communicating with your legislators, definitely.
And I mean, I can make that contact with a phone call, with an email, and most likely I won't get the legislator per se, but I can pass that information on to their staffer, right?
And their staff take notes and write down when people call in favor or against bills. So, yep, absolutely.
Well, thank you.
Great. So I think we've about run out of time. Speaking of next week, what do we have going on next week, Sarah? Mike?
It's your session, Katie.
Oh, that's right. Actually, Aaron from
was a
ARI
test.
helped put it together. Sorry. We are going to be featuring the Disability Empower Her Network, which is a new venture of two former SIL employees, not our SIL, but a SIL. And I think it's going to be really cool to hear what they've got going on to empower young women and girls with disabilities as they grow up and navigate life as a female with a disability. So next week, join us for that. I think it'll be interesting. Are there any community announcements quickly?
This is Cheryl. I just wanted to update on one of our sessions from before, the fuel service presentation. So I attempted to use it, and it was great, except for one thing. If you use a Discover card as your credit card, it does not recognize that card here in the US. So folks should be prepared to either use cash or a Visa or an American Express.
Great, thank you for that feedback. All right. Anyone else? Oh,
I got one. Of course, we know for all SILs that housing is always a big ask. Independence Now is hosting our next monthly housing seminar on this Thursday the 25th. And please encourage your consumers to come and learn some of the basics that is needed for persons with disabilities, what information is needed to provide in order to qualify for some of these affordable housing programs.
awesome. Thank you. Anyone else?
In case you need it really quick, Abiola posted the song. So in case we got the jingle in your head for
I still have the jingle in mind.
how bill becomes a law, you can.
Oh, I still do, sir.
Can click and listen to it when we're finished, just in case you need a
Can you
fix.
stop unmuting me, please?
All right.
I've I'm sorry, this is Bonk. So
yes,
I've never heard of that song, but in any case, that's fine. But I did want to go back and I just wanted to let everybody know on this call, going back to what Katie had said earlier when she was talking about the newly formed policy group, and one of the issues was transportation, and one of those issues was also in regards to floating bus stops or island style bus stops. If there is anyone on this call, and I think Heather can put my information in the chat for me, please. But if there is anyone on this call that is interested in either voicing their concerns or opinions or just hearing more about the floating bus stops, please feel free to contact me. I just hosted a meeting, my second meeting about it last week. I will not be hosting another meeting for about another 2 months, but definitely get me your information so I can include you in the next one.
all right. Well, ladies and gentlemen, I think we have run out of time, but thank you so much for joining us. And thank you to the Maryland Statewide Independent Living Council for partnering with us on this, what I think was a fantastic webinar, if I do say so myself. And we will see you next week.
I agree, Katie. It was fantastic, and I enjoyed everybody, and everybody was very informative. So yes, let's do it again.
And get on with people on the Go Maryland.
Gotcha.
Yes,
All right,
Shepherd
everyone,
Press.
take care.
You too.
Thank you. Bye-bye.
Bye.